You ever get your HESI scores back or your ATI exam and you're like, how in the world did I get that question wrong? What was I thinking? Well, I'm here to help you today as we're going to go over some NCLEX questions to prepare you for prioritization and delegation, which is a huge piece of the NCLEX exam. So first, let's start with this question. A client is admitted to the hospital with a diagnosis of cirrhosis, has a massive ascites and difficulty breathing. The nurse performs which intervention as a priority measure to assist the client with breathing? A, repositioned to the side every 2 hours. B, elevates the head of the bed to 60 degrees. C, auscultates the lung field every 4 hours. Or D, encourages deep breathing exercise every 2 hours. Okay, so for this one, what's our priority? It's always A, B, C, ABCs, right? So we're always worried about airway. So if this person has massive ascites, which is a giant fluid buildup in the abdominal area, it's putting up pressure on their diaphragm, and so it's making difficulty to breathe. So the first thing that we're going to do is elevate that head of the bed to 60 degrees. So the correct answer is B. The other things we can do, and it's going to help assist us as we do our assessment on their breathing, but none of the ones other than B are actually going to relieve that diaphragmatic pressure, and that's what the goal of this question is. A plan of care for a client receiving enteral tube feeding. The nurse identifies which nursing diagnosis as the highest priority for this client. We have A, diarrhea, B, aspiration, C, risk for fluid volume deficit, D, imbalanced nutrition less than the body requirements. So again, what is our prioritization? A, B, C, right? ABCs. So then, which one of these has to do with that? Of course, it's B again, at risk for aspiration. Here, anytime they're on enteral tube feedings, then they're risk for aspiration, okay? Although A and C and D are concerns for this patient, they're not the priority for this patient. So again, the answer is B. Our next one, a client arrives at the ED with an upper GI bleed and is in moderate distress. We have to figure out what our priority nursing action to do is. So our options are A, obtain vital signs, B, ask the client about precipitating events, C, complete an abdominal physical assessment, and D, insert an NG tube and hematest the emesis. So which one of these is your priority? Again, go back to those priority letters I've said for the last couple of questions, ABCs. Okay, so the correct answer on this one is going to be A. Why? First, we need to determine if the client maybe is in potential shock from a substantial blood loss due to the bleeding. We also want to determine a baseline in terms of our vital signs to monitor this patient for our assessment as we move forward. The patient might not be able to, so if we're looking at B, that one's incorrect because the patient's probably not going to be able to provide us any sort of answers until their actual immediate needs or concerns are met. And C, we're going to perform that, but again, it's not a priority. And then an NG tube might be an action that we perform per the order, but again, it's not the priority. The priority is that C, circulation, and we're going to assess that by obtaining those vital signs. So again, it comes back to those three things, ABCs, airway, breathing, circulation. Next prioritization question, we have a client who has a history of suicidal attempts is admitted to the mental health unit with a diagnosis of depression. You're the nurse, and upon the client's arrival, the client's therapist calls and reports that the therapist earlier in the evening they spoke and they reported having overwhelming suicidal thoughts. Keeping this information in mind, the priority for the nurse is to assess for A, interaction with their peers, B, the presence of suicidal thoughts, C, the amount of food intake in the past 24 hours, or D, information regarding the past medical regimen. Okay, so answer is B. And if you got this one wrong, I'm pretty worried about you. Pretty much worried about you. You're gonna have to watch a lot of these videos. But the answer to this one, of course, is B, the presence of suicidal thoughts. Our main priority, obviously, of course, is keep our patients safe. So we want to assess if they're having thoughts of suicide or if they're going to be a harm to themselves or others. So that is our priority. Okay, we're not going to really do anything else until we assess that. Those other things we can assess, but the evaluation of suicidal thoughts is the most important priority in this situation. All right, so this question, we're gonna look at a little different group here. We're gonna look at a homeless population. So where a group of health nurse is caring for a group of homeless individuals. When planning for their potential needs of this group, what is the most immediate concern for them? We have A, peer support through structured groups, B, finding affordable housing, C, setting up a 24-hour crisis center and a hotline, or D, meeting the basic needs D, meeting the basic needs to ensure that adequate food, shelter, and clothing are available to this population or this group. So the correct answer for this one, of course, is D. You got it right, I know you did, right? So D, the ABCs are air, breathing, circulation, but when we're talking about community health, the ABCs of that is make sure their basic needs are met, which include their food, their shelter, water, and clothing. Those are their ABCs of community health, right? A, B, and C are things that we could do at later dates, but again, they're not the priority. These questions are always asking, what is the priority action of you, right? And here it is D. Okay, so we're gonna continue in that theme and we're gonna look at you as a community health nurse potentially again here. So now you're working with residents who were involved in a recent flood. Many of these residents are emotionally despondent and they refuse to leave their homes for several days. When planning fourth and rescue relocation of these older residents, what is the first item that the nurse needs to consider? So our options are A, contacting the older residents' families, B, attending to the emotional needs of the older residents, C, arranging for ambulance transportation for the oldest residents, or D, attending to the nutritional status and the needs of the older residents. Again, I know you got this one right because I just told you about it in the last question. The ABCs of community health nursing are to meet the basic needs of our population. So here it's elderly people, older people, and so their basic needs are again are food, water, shelter. So the one that encompasses that is D. So I know you got that answer right. Great work. D is the correct answer. All right. A client is in a long-term care facility and has a series of GI diagnostic tests. These include an upper GI series and endoscopies. Upon return to the long-term care facility, the priority nursing assessment, you should focus on which of these? A, the comfort level, B, activity tolerance, C, level of consciousness, or D, hydration and nutritional status. So we had GI tests, upper GI series, which are barium enemies, endoscopies, several things. So your priority assessment is going to be D, the hydration and nutritional status of this patient. Why? Well, most of those procedures require the patient to be NPO or nothing by mouth for 24 hours. Also, if it's a GI series, if it's a lower endoscopy or a colonoscopy, those are usually clean out the patient via laxatives or enema type things. And so those can put the patient at risk for dehydration. With that, nothing by mouth for 24 hours, if it's been several days, the patient could be malnourished. So we want to check the hydration and nutritional status of this patient. Again, those other ones are going to be helpful, but not the priority at this time.